sent letters out to them, as well as in each local government, we have listed all the churches, the schools, the mosques, and letters have been sent out to them prior to the implementation dates to create awareness and to gain their compliance, to cooperate when our vaccination teams get to their churches, mosques, and the schools. So all these things we have put in place. Then at the ward level, we have community mobilizers that are, empowered with megaphones and bells to move from one street to the other, from houses to houses, to create awareness by using the megaphones alongside with the team members. Okay. They start their own programming, their awareness creation at the community level a day prior to the implementation day, to create awareness. Likewise, the social media is not left out. Okay. There are lots of WhatsApp messages that have gone out right from the beginning of this outbreak response in Lagos State. We had the outbreak response 0 in 2 local governments of Mushin and mainland local governments. Then we had the first outbreak response that's a statewide program. And this is the second outbreak response that we are doing now. So we have sent a lot of messages through WhatsApp, through Facebook, and through Instagram to people to be aware of this program, that it is essential that all children that are still between the age of 0 to 5 years are vaccinated in all the ranks, whether they have been vaccinated before or not, irrespective of their immunization status. They are to be vaccinated again. Okay. In all the ranks.
I was going to ask you that question. I actually have 2 questions, but let me start with the most recent point that you've made. Is there any harm when someone who has been vaccinated before gets vaccinated again? In other words, for somebody to be vaccinated twice, is there any dangers attached to it?
Thank you very much. Vaccination for the outbreak response, like we have been sending out, there is no harm to be vaccinated before and be vaccinated again in this round. I want to let us know that because some people are calling that, they have completed their routine immunization. Yes, completing the routine immunization is different. The vaccine we are giving this round is different from the routine immunization. The vaccine for this outbreak response is specific to the strain of virus we found in our canals to prevent the spread of that strain of environmental virus from getting to the body of the children that they come in contact with. So getting vaccinated as in the clinic, the routine immunization is different from this outbreak response that we are doing. And getting vaccinated during the first round is still a booster to have this again. Every child that was vaccinated during the first round should be vaccinated during this round again.
So there's no danger?
No danger attached.
Right. That's what I want to know. You mapped out a couple of strategies that has been put in place in terms of creating awareness. Now, looking at all the strategies that you've carefully outlined, would you say that it is proving some benefits? If you make an investment, you expect returns. Would you say that you're getting the returns of the investments that you've made in terms of putting those policies in place? Is it achieving the goals that you had in mind when you were creating those strategies?
Well, we have done a lot, right? As in the strategies of creating awareness, mobilization. But what we are seeing is not as much as what is expected. Like in schools, in spite of the fact that we have created this awareness amongst the community leaders, among the stakeholders at the state level, even at the local government level and the ward level, we still have rejections. There are some times that we get to the schools. The school authority will have received the letters But some have not been sending out the letters to the parents. So when we get there, they normally tell us, oh, we are going to send it tomorrow. We are going to send it, come back on Saturday. The fact is that this program is being carried out for 4 days. Saturday, which is 15th, Sunday, Monday, and Tuesday. Today is the last day, expected last day. But we still have some schools that are not cooperating, some school authorities, particularly the private schools. They are not cooperating with us. They want us to come back again on Saturday when the program has ended, which is not like that. It's not supposed to be so. So we are expecting them to cooperate. Immediately the letter gets to them, they should have sent the letters, to the parents, informing them that the vaccination team will be coming at so date. Most of the time we visit the schools on Mondays and Tuesday of the implementation days. So, and we expect by getting there, we will have their cooperation. By times, even the gatemen will lock the vaccination teams out. They won't allow them to come in. And some authorities will chase the vaccination teams away. Government is spending much money on these programs just to get our children healthy and make them survive. But alas, the people are not cooperating.
Don't you think this is a matter of orientation that the people have had over the time? I mean, so some people will say, well, why are the government paying much attention to polio when you have cases of malaria? They're not giving free treatments, they're not doing this, they're not doing this, they're not working up technologies and inventions so that they will make vaccines that will make people immune from malaria. So don't you think it's a matter of the mindset? And now, if you agree that it is a matter of mindset, what are the things that are being done in order to change the mentality that the parents have had, that these schools that you've mentioned have had? What are you doing to address these things, the challenges that you're facing so far?
Thank you very much. Let me just come this way. If we look back to the early 70s or 60s, when we were in primary schools, the public hygiene personnel will come to the schools to vaccinate the pupils with this number that we call it number 10, bringing the machine pan on the arm. And by so doing then, the target then was to eradicate smallpox. The same way we are doing now to eradicate polio. Now there is no more smallpox. Then people were dying from smallpox. People were being, having blindness, a lot of disabilities from smallpox. Likewise, this poliomyelitis that we said can result to irreversible paralysis or death of the child. Now, if these people had cooperated with us, we have put, like I said, we have put a lot of sensitization, including jingles. We play jingles around. We send, with these letters we send, and the involvement of the media. I believe your organization was part of the sensitization last week, Thursday. And so many media houses were with us. So we are putting a lot, but yet individual differences among the people. So we are seeking the cooperation of the people. Health workers are parents too. We vaccinate our own children likewise. And we know if these people cooperate with us, with all the things we have put in place, we can send polio packing from Nigeria.
Which is what will necessitate my next question. Yeah. This is my final question for you. I know that there's a World Polio Day. Yeah. Could you tell us about that and why it's important for us to have such a day?
Yeah. Because of the importance and the burden of poliomyelitis. which we call polio, that is why a day had been set aside to create awareness, to scale up awareness of the people concerning the danger of this poliomyelitis. So it's being done yearly on October 15th, to sensitize the people, concerning poliomyelitis, and to make sure that they vaccinate their children against poliomyelitis.
All right, it's been so nice speaking with you, I have to say. All right, we've been having the conversation with Mrs. Clara Modupe Owojuyigbe. She is a health worker and also the Director, Health, Education and Promotion of the Lagos State Primary Health Care Board. Many thanks for coming on the program today.
Thank you very much.
Okay, we'll take a break at this time, and when we come back, we'll be looking at something interesting as well. So you want to stay with us, the program continues after this break.